Dear students, today I am going to speak on the topic renal failure, acute or chronic. Introduction. The state of a person's health is directly related to the person's lifestyle, with more and more people opting the Western food culture, which involves stuff high in saturated fat, salt, and calories, but low on fiber, vitamins, and proteins. Obesity is on the rise. This in turn is leading to a higher incidence of hypertension and diabetes than before. While a third of the population is obese, over half the people suffer from hypertension, often leading to ailments of heart, kidney disease, and blindness. India is fast becoming a world diabetes capital. The World Health Organization has predicted that going by the current trend, it will become diabetes capital of the world by 2025. Diabetes is 2 to 4 times more prone to heart disease and 30 times more prone to kidney disease than others. Diabetes mellitus is still the main cause of kidney disease in adults in the 40 to 60 age group. There is a rise incidence of chronic disease that is likely to pose major problems for both healthcare and the economy in the future years. In India, it has been recently estimated that the age-adjusted incidence rate of end-stage renal disease, ESRD, to be 229 per million population, and more than 1 lakh new patients enter renal replacement programs annually. Failure. It is caused by 3 different types of conditions: diseases which may damage the kidneys, conditions that slow blood flow to the kidneys, and those that block urine from leaving the body. Diseases or conditions that may damage the kidneys include autoimmune kidney diseases, for example lupus, urinary tract infection, toxins such as alcohol, heavy metals and cocaine, malignant hypertension, transfusion reaction, scleroderma, diseases that may block blood flow to the kidneys, cholesterol deposits that block blood flow in the kidneys, multiple myeloma, decreased blood flow due to very low blood pressure which results from burns, dehydration, hemorrhage injury, septic shock, serious illness, surgery, diseases that block urine from leaving the body, cancers including bladder, cervical, colon, prostate, blood clots in the urinary tract, enlarged prostate, kidney stones, damage to the nerves that control the bladder. Causes of chronic renal failure. Chronic renal failure is generally caused by diabetes mellitus type 1 or type 2 diabetes and high blood pressure. It causes the kidneys to stop working, leading to end-stage renal disease, ERSD. Some of the causes are the same as acute renal failure. They include kidney infection, polycystic kidney disease, multiple cysts in the kidneys, autoimmune disorders such as lupus, hardening of the arteries which can damage blood vessels in the kidney, kidney stones, and signs and the symptoms of acute renal failure. Decreased urine output, excessive urination at night, no urination, although occasionally urine output remains normal, bloody stool, nosebleeds, decreased sensation, especially in the hands and feet, shortness of breath, fatigue, confusion, nausea, seizures or coma in severe cases, chest pain of chronic renal failure, appetite loss, general ill feeling and fatigue, sleep problems, decreased mental sharpness, muscle cramps and twitchiness, headaches, itching and dry skin, nausea, decreased urine output or no urine output, excessive thirst, frequent hiccups, menstrual period stops, amenorrhea. The future of the condition and the case of treatability depends on the medical problem that caused the kidney failure, how much kidney damage has occurred, and what, if any, complications are present. As the kidneys are highly adaptable, symptoms of kidney failure may not appear until irreversible damage has occurred to the organ. Diagnostic test, whether acute or chronic kidney failure, there are a number of tests that the doctor may recommend for diagnosis. Blood test. Kidney function test look for the level of waste materials that is normally filtered by kidney. Examples include creatinine, urea, potassium, and magnesium. In general, the blood becomes more acidic with renal failure because of these waste products. Imaging test for renal failure is the loss of the abilities of the kidneys to remove excess fluid and electrolytes as well as waste from your body. Acute renal failure happens quickly or suddenly. Chronic renal failure happens gradually over a period of weeks, months, or years. Both are serious conditions that require immediate medical attention. The doctor may use ultrasound, intravenous pyelogram, MRI, CT scan to image and access kidney biopsy. The doctor may remove a sample of kidney tissue and have it sent to a lab for testing. Kidney biopsy is often done a long thin needle that is inserted through the skin and into the kidney before a tissue sample is removed. Yes, analyzing a sample of urine may reveal abnormalities that point to chronic kidney failure. Treatment. Treatment of renal failure depends on whether it is acute or chronic. If acute, the goal is total recovery. Chronic kidney failure has no cure, so the goal are to treat the underlying cause of the kidney failure. Treating its complication and prevent further deterioration of the condition. Treatment of the underlying condition. There are many different possible causes of acute and the chronic renal failure, and so treatment depends on the correct diagnosis and the finding the treatment that is right for you. For example, if the renal failure is caused by a urinary tract infection, the doctor will likely prescribe antibiotics as the first line of treatment. Treatment of the complication depends on the severity and other symptomology. If waste products are building up in the blood, the patient will likely be a candidate for dialysis. It removes the excess metabolic waste and water. Therefore, during dialysis, a machine pumps blood out of the blood through an artificial kidney dialyzer that filters out waste. The blood is then returned to the body. If there is significant damage and patient has end-stage renal disease, he may be a candidate for a kidney transplant. Prevention. As there are a number of different diseases and the conditions that cause acute and chronic kidney failure, complete prevention is impossible. However, you can minimize the risks and the stressors on the kidneys by limiting your consumption of alcohol, quitting smoking, maintaining a healthy body weight, regular exercise such as yoga, and taking all medications according to the doses and the timing prescribed. Dietary management of acute renal failure. In the first 24 to 48 hours, food and the liquid intake by mouth are restricted. Glucose is given intravenously as oral intake is limited due to nausea, vomiting, and lack of appetite. A protein-free diet may be given before a patient is put on dialysis. Another approach is to give glucose with essential amino acids orally by tube feeding. The fluid allowance is 500 ml to make up for insensible water losses plus the urine output. More fluid is provided if there is vomiting, diarrhea, fever, etc. to prevent dehydration. Energy intake should be enough to prevent catabolism. 20 to 40 protein is given gradually of chronic renal failure. The diet planning takes into account the stage of disease, its causes, blood vessels of urea, and the electrolytes, nutritional status, other diseases occurring, and if the patient is on dialysis. The patients awaiting dialysis have a more severely restricted diet compared to those who are on dialysis. Energy. To prevent tissue breakdown and the release of nitrogen and the potassium into circulation, an intake of 1,900 to 2,000 kilocalories per day is indicated. Main sources of energy are carbohydrates and fats. Their metabolic end products do not pose a problem for the kidneys as these are excreted through the lungs, sweat glands, and bowels. Protein. Protein intake is reduced to reduce work of kidneys of excreting and the products of protein metabolism, namely urea, creatinine, uric acid, sulfate, and organic acid in the urine. Most of the protein, 65 to 75% in the diet, should be of high biologic value. Minerals. Potassium and sodium intakes need to be restricted to avoid hyperkalemia, edema, hypertension, respectively. Phosphorus is often restricted to 600 to 1,600 mg per day to prevent metabolic acidosis. Supplements of calcium, iron, and B vitamins need to be given as restricted diets are low in these nutrients. Calcitrol may also be given as a supplement as kidney is not able to produce vitamin D hormone. Fluid is restricted when urine output is low. The total fluid intake is equal to the volume of urine output plus about 500 ml for insensible losses. The fluid intake includes water present in foods and beverages. Thus, 100 ml of milk provides 87 ml. 100 gram of fruits and vegetables provide 80 to 90 ml of water. Conclusion. Treatment of renal failure depends on whether the condition is acute or chronic. Acute renal failure is fully treatable and patients are expected to make a full recovery. There is no cure for chronic renal failure, although its symptoms can be managed. The first step of treatment is identifying the underlying cause of renal failure. For chronic and acute renal failure, there are a number of procedures and the medications and the lifestyle changes that will help manage the symptoms of disease and prevent the condition from worsening. And